Hey, everyone. It's Dr. Tamara Beckford with Your Caring Docs, and this is our Docs Who Care show. Yes. So I'm super excited about today's show. We have an award-winning author. Hello. Yes. On woo woo. Yes. And we are going to be going over some things for all of our college students. Yes, you want to check out this episode. And if you have a college student at home, your cousin, your aunt, somebody you know has a college student, you want to let them know about this episode too, right? But let me bring my wonderful guest in, Your Caring Docs fashion, right? So this wonderful doctor of mine, she's a graduate from the Baylor College of Medicine. So all my Baylor Bears, boom. Yes, there we go. She did her training in family medicine in Austin, Texas. Austin, we still keeping it weird. Love it, love it, love it in Austin. Yes. She is a clinical instructor at the University of Massachusetts Medical School, right? She is a nationally recognized medical media expert and an award-winning author. That's right. Her latest book is The Ultimate College Student Health Handbook, right? Your guide for everything from hangovers to homesickness. Welcome, Dr. Jill Grimes.
Thank you. Yes. I'm super happy to be here. Thank you. I love your positive energy.
Oh, thank you. Thank you so much for stopping by here. Now, Dr. Grimes, before we get into the college years of these college students that we are going to help today, let's bring it back to the beginning. And you let us know what made you decide to become a doctor.
Okay, so there was multiple things that came together, but a funny thing, well, one, I would say my father was a college professor and we lived all around the country as he moved up the academic ladder in administration. So education, like it was never, if you're going to college, it was where you're going. So, and true story, when I was in 5th grade, I had straight A's and a C in handwriting. I was so upset. I still have messy handwriting. I had the wrong grip on the pencil. They were always correcting it. And, she just told me, she goes, Jill, don't worry, you can be a doctor.
I love it.
I went home and I told my parents that. And my dad's like, well, okay, that works. Anyway, so that was what put the idea in my head. I also, there's a lot of things that you don't think about, but I had a brother that had some congenital issues that he had to have surgeries for when he was older. I'm the youngest in the family. My older sister ended up being an OB-GYN. My brother's an engineer. But anyway, so there's things that come together, but that was what planted the seed. And then I just kind of latched onto that. And that became kind of part of my identity that I wanted to be a doctor when I grew up.
I love it. I love how teachers really help to mold us from many different facets, right? From the fact that like, yes, you're great versus, oh, your handwriting. Don't worry. You could be a doctor. Don't worry that you didn't get the A's.
Way before electronic medical records. So.
Right. And then here we are. Many years later, electronic medical records. Wonderful. So that story really touches my heart because I'm working on my son's handwriting now. Ooh. Now, as opposed to you, I had the best handwriting in the 4th grade.
Well, congratulations.
Thank you so much. But I had the C in art. So there we go. Wonderful. Okay, so now you're here and you've decided to go into medical school and you're a doctor, but then you decided to do family medicine. So what brought you into that specialty?
Well, one, again, growing up, I had no doctors in my family. My dad was PhD. We said the doctor that can't prescribe a pill. But the only doctor I ever went to was my family doctor. And so to me, that's what being a doctor, when I said I wanted to be a doctor, frankly, I never I thought about that. And then when I got to medical school, I honestly, I was that med student every single rotation. Oh my gosh, this is so cool. Oh, yes. I love delivering babies. Oh, surgery is so awesome. I love this. And I really, really genuinely liked every rotation except one, which ironically is my husband's specialty. He's an anesthesiologist. The spit thing didn't work for me.
Right.
Anyway, but I have great respect for anesthesiologists. But one of my last rotations actually was family medicine, and I will say it was a married couple that Jay DeBrock and Linda Holleran. I just give them a shout out.
Absolutely.
They role model and still do everything that I thought a good person would be, and a family physician in particular. I will never forget one day on the rotation, this older woman came in on Medicare, and she had diabetes and hypertension, hyperlipidemia, and she did not have enough money to buy her medicines. Jay, Dr. DeBrock, he didn't even bet. I wasn't supposed to hear this. This was not for my benefit. But basically, he had his medical assistant. Their office was right next to a grocery store where there was a pharmacy. He paid for her medicine and groceries.
Wow. So this is Dr. DeBrock. Is it over here in Houston area?
Yes.
I take care of his patients. Wonderful.
You totally get it. And
yes.
And he would probably be mortified that I told that story, but
that's okay.
The two of them, they were so kind to everybody, and they never rushed anybody, and they were kind to me as a medical student. And I'm like, oh my gosh, I want this to be my life. I was so inspired by them.
Oh, that is so wonderful. And, that's one of those ways of passing on the tradition of being an excellent physician that sometimes you don't realize when you're working and you're doing your best work and someone's watching, you're inspiring someone else without them even knowing. Like, that is just so heartwarming. Love it. If I ever get to see Dr. DeBrock, I might go try to visit him. We're going to show him this video and let him know how much he has inspired you. Yes, this wonderful, accomplished doctor just by being a wonderful human being. Wonderful, wonderful. Oh, this is heartwarming. All righty. So now, you've been practicing medicine and you're working, and then you decide, on top of everything else that I do, I'm going to add author to my name. So what made you decide to go into writing books? Tell me.
Yeah, so that was weird. Basically, what happened was my private practice was in a fabulous part of town where people are very privileged, well-educated, every opportunity. And I really pride myself on preventative medicine. In family medicine, obviously, that's my passion. I like to fix things, but I'd rather prevent them.
Right.
And the one thing I just kept seeing over and over and over was people, both moms and dads and teens, being surprised that they caught a sexually transmittable infection. At the same time, people were asking me really specific details about episodes of Grey's Anatomy and Dr. McDreamy, and they could remember all of that, but they couldn't remember like kind of basic sex education. And they were getting it. It's not that they weren't getting that education. And I realized that it's the story, because stories are more powerful than statistics.
Absolutely.
And that is my byline. I say that over and over again because it's true, because we get invested in them, we remember them. And so I thought, what if I just wrote some pamphlets for the office? And so I wrote one of the most common thing that I saw, which was actually a beautiful, successful, I can't remember if I picked a cheerleader or a football player, but I picked purposely someone, the standout that everybody admires, and had a story of them getting genital herpes from oral sex. And so I wrote the story, and then I wrote another one, and for a different one, because it was very effective. And then I had several friends in medicine, in the publishing world, that said, really, you ought to write this, make it a whole thing and make it a book. And I was like, oh, yeah, sure. Yeah. So I wrote what I thought was my book, which I'm like, okay, for a young adult, I want it to be 100 pages, 10 chapters, 10 pages each. I'm going to go 10 diseases. Boom. I'm done. Wrote it. Okay. Now who's going to publish my book? And then turns out no one wanted to publish a book on STDs.
Oh, wow.
No one wanted to talk about it.
Yeah.
Publish it. And that's why the publisher's like, well, who's going to buy it? I'm like, well, parents are going to buy it. And they're like, no parents going to buy that. And I'm like, well, I thought they might. And anyway, I ended up going to a publishing conference at that Harvard Medical School put on for about a decade, and that I subsequently became a book pitch coach at, because I loved that conference so much. And I went back and was fortunate to be a part of it later. But anyway, I went there, stood in front of a ballroom of 500 physicians, all of whom got it. My original title was Stirrup Tales.
Oh, yes.
Physicians all thought was hilarious. And the publishers thought was not good enough. So that book became Seductive Delusions, How Everyday People Catch STDs. And then actually, for those of you who learn to do an elevator pitch, whether it's about your practice or a group or whatever, let me just tell you, it's so important, and you use it for so many things. I went to my 10-year high school reunion in San Antonio and ran into my old, he had been a vice principal then, who was then the superintendent of San Antonio and of the Northeast Independent School District. And he's like, "Hey, Jill, did you ever become a doctor?" Because I did. And he's like, "What's new?" And I'm like, "Oh, I just got this book contract, and I'm wrote this." He's like, "What's it about?" And I'm like, "Shucks, STDs." He's like, and he perked up and he's like, "What's it about? Tell me about." And I basically gave him my little 60-second elevator pitch about it. And he's like, "We have a problem. We need better education." And I'm just going to fast forward and tell you that 2 years later, my book was adopted into the high school curriculum in that district, which was no small feat given the topic and the
absolutely.
But and then fast forward again, treating students at the University of Texas, where I worked part-time for a while. And I would have students come in from San Antonio, and I'm like, "Oh, do you remember this book?" And it was so funny because they would just light up and they're like, "Oh my gosh, that was the only interesting thing in that class." Okay. They're like, "Oh yeah, you scared us off of that for about 6 months." And I'm like, "Oh, it wasn't intent to scare you. It
was in to educate you." But
anyway, so that's how I initially became an author. It was not like I was dying to write a book.
Wow. It goes with that heart that you have of educating and being that doctor that really wants to prevent, that really got you at the core from what you saw, that what you wanted to emulate. So you're doing it your way. So that's your version of buying that prescription for that family, for that woman. This is your way of doing that by writing stories, because you recognize that I can sit here and tell you, did you know that such a percent of people who have this and no one's going to listen. Exactly, snore. But if I bring it to you in this interesting story, because if you're looking at McDreamy and you can tell me every details about Grey's Anatomy, why don't we have a wonderful story that can highlight some of the importance of knowing about yourself and how your body works and how these diseases are transmitted? Wonderful.
The main thing too, I just wanted to dispel the myth that, everyone's like, "Oh, well, that person wouldn't." I mean, for STD, they're like, "Oh,
but clutching pearls."
Yeah, I'm like, no, they would never have an STD. And I'm like, or, they get one STD and I diagnose them with that. And I'm like, "Okay, well, let's go ahead and test for everything, like including HIV." And they're like, "Oh, she would never have that." STDs travel in packs. They're transmitted the same way. If you've got one, you can have the other. So I just wanted to kind of just make it, let's just let's
and just understand
of the popular people.
Absolutely.
I mean, and it's not just the popular people; it's everybody. But the point is that perception that it's the whole Instagram polished perception, which wasn't a thing when I wrote the book. But it's you think people's lives are perfect and that they would never have something that you don't want to talk about. So
Absolutely.
anyway,
Yeah, this is the taboo topic, as we were saying, that taboo topic. So now what I love about that, you have this wonderful book that you're able to get through, but then you decided, you know what? I'm going to write some books for these college students out there because they are sitting there having, my throat hurts. Is this strep? Is this COVID? What's going on? And they're like, oh my gosh, I don't know what's going on. It hurts when I do that. Am I dying? What's going on? So, and then you have the, I'm hungover. How do I treat these ailments? I'm not supposed to tell mom that I actually did get hungover, right? Because I am the perfect role model kid. My parents, something happens. And then, like you're saying, sometimes we were talking behind the scenes that our parents are like high achievers. And then you have the high achieving child who now catches this sexually transmitted infection and think that their life has ended. Like there's nothing else. So let's talk about that. What was the inspiration for this book, for the ultimate guide for the college students? Handbook. Woo-hoo, there we go. Fresh off the press. Show them again. This is fresh off the press, the new edition. There we go.
The first edition was in blue. The second one is actually, you can't tell, but it's maroon. I'm Maggie, so
yes. Oh, okay. All righty, Texas A&M Aggies. That one's dedicated to you.
Thank you. There's the rain people.
Okay.
So how this one came about. So again, I'm really crafty. I love art, and it was
what I got to see in. But go ahead.
I'm not rubbing it in or anything. I'm just. I love it. So I was always like the crafty girl. So about 10 years ago, actually time is flying, about 12 years ago now, my next door neighbor, her daughter was going off to college. And this girl babysat our little girls. And so her mom said, hey, could you, I'm like, well, what does she want for high school graduation? And she's like, actually, what is she going to do when Dr. Jill isn't next door? And she's like, can you do something for her? And I'm like, oh, I'll make her a college first aid kit. And so the first, my first college first aid kit was born, and I decorated it, and I had as much fun crafting it as I did putting the correct ingredients in there. I was really proud of it, ribbons decked out and all this, and so I gave it to her, and her mom's like, great, she didn't know how to use any of this. Like, she's like, this is great, thank you for this. And she's like, Jill, can you just, and she literally whips out an index card, and she's like, can you just write down when to take Tylenol versus Advil, which cream to use, what, and she rattled off 5 things she wanted me to write down. So I wrote it down in the index card. So the next year, when I was making it as a gift again, and then the next 10 years where that became my standard gift, including when our girls went off to college. And so for high school graduation, I made these elaborate first aid kits. And what started off as a one index card ended up being about 20-page laminated booklet.
Here, by the way.
Very, very, because I was putting in there, what do you do for food poisoning? What do you do for hangovers? Sprained ankles, colds, all this stuff. And so I realized at that point, and I had subsequently written several more books in the meantime, I'm like, oh, this is it. This is my passion project. Oh. This is the book I was meant to write. And also I had given up my private practice after 20 years, and I was working part-time and seeing college students. And so I'm very well situated to know what they know, what they don't know, and what they don't know, they don't know. And so, I included things in there, for the physician audience, of course, DVTs and pulmonary embolisms from, if you got a young girl on birth control and you got chest pain and you call, the triage nurse is bringing you in.
Right.
And so, I wanted to bring that to attention, or spontaneous pneumothorax, and, which we see, let's see it probably once a month. I mean, it's so funny because going from private practice in the same town to then just seeing young adults on a college campus, it's like, oh, okay, we see this more often here.
Oh, yeah.
It's very interesting. So that's how this all evolved.
Wonderful, wonderful. So this wonderful book that is, here helping so many students really started off as a kit, a first aid kit as a gift for a neighbor. Like, how wonderful and awesome is that?
Yeah.
This beautiful decked out kit. And the neighbor's like, oh, this kit is so beautiful, but how do I use it?
So actually, I made the publisher let me put in the book all my first aid. I've got a shopping list. You literally can just check it off.
Love it.
Get this, get that, and then I've got my cheat notes that used to be in my laminated booklet. So I've got the Reader's Digest version, Spark Notes, whatever you want to call it. I've got
Cliff Notes, or
if you just boom, it's right there. Because
wonderful.
And yes, Dr. Google is out there, and yes, kids are going to Google stuff. But the thing is, if you think you're having a migraine and you go in and you go into Dr. Google, the next thing it's 2 a.m.
I always ask them. So yes, absolutely, yes.
Yes. So this is to help them recognize what they can do now. What's the worst case scenario if you do nothing? When do you really need to go be seen? If you're seen, what to expect. And I'm just gonna throw this in here right now because this is all doctor parents mostly, right? I just want to say, please, on behalf of every physician who works in a college campus, please do not tell your kid you need to go get antibiotics.
Oh no, because that's implanted in their mind, and no
matter go in and get an X-ray. You don't know how many sprained ankles, the percentage that do not need X-rays. I mean, I'm preaching to the choir if you're ortho or primary care, and but and the other thing is, as physicians, we feel like we should know everything, right? Because we were exposed to everything. But one of my best friends is an ophthalmologist, and she's like, I don't remember this.
Okay, you can ask me anything about the eye, but
yeah, I mean, and so don't recognize
it's okay to just say, hey, why don't you go to your student health doctor and tell them what you're feeling, and then have the doctor evaluate.
Right.
That's okay to say. Have them evaluate you and let me know. Wonderful. I love that your handbook has the what to expect. What to expect if you don't do anything. What is the worst case scenario? Right? Here are some ways to offset some of this. Right? It's not everything's a tumor. Remember that so that Arnold Schwarzenegger movie Kindergarten Cop? Like not everything's a tumor. Sometimes people can just get pain and it is fine. So it's okay to get evaluated by the doctor at your college, health care center, and then see what's going on. Now, here's another thing that's happening with these perfect high achievers. They go off to college. Mom and dad get a call. Oh my gosh, my kid's smoking pot. What? Not my kid. So let's let these high achieving parents know what's going on in their children.
All right. So this is a real hot topic for me. So one, I want to reassure everybody that is listening, if you are frankly freaking out because your kid, who was always perfect, for lack of a better word, the model kid, went off to college and you discovered, usually they're not telling you they're smoking pot. It's more that people discover it when they're home for winter break or on the summers, or different ways that they discover it. But I get so many direct messages on Facebook, mostly from people I don't, physicians that are my Facebook friends in these groups and stuff, and I never mind. But let me just say this. First, let me start here. 1/3 of college students do not drink, do not have sex, do not smoke. Not everybody is doing it, whether you're referring to sex or drugs or drinking. Okay, it's not everybody. But in a given group, and I'm going to pick on the Greek system. Not every fraternity, not every sorority has issues with this, and some excel at not having issues. But as a group, particularly the guys, the frats, there's still a ton of binge drinking. And so if I tell a freshman who is pledging a frat that, say I'm treating them for, I'm giving them IV because they're dehydrated from a hangover.
Mm-hmm.
And that, we'll talk about blackout drinking later. But anyway, I'm having a pertinent conversation with them and just saying, well, what's your, if I were to tell them that a third of college students do not drink, they think I'm nuts. And I have no validity with them because maybe 98%
in their group
does. So going back to pot, I want you to recognize that your kid and their friend group very well may have a friend group where a very, very high percentage are smoking pot. Obviously, it's legal in some places. It's not legal in others. If you think it's not prevalent, if your kid is in like the honors program, you're wrong.
Say that again.
It's very common in high achieving, highly successful college students. And the higher the stress, what we see, and okay, look, I'm seeing a skewed sample because I'm seeing people who are coming in with problems. I recognize I'm self-selecting for a skewed sample, but I always ask them, what percentage of your friend group does X, Y, or Z, if it's something that we're talking about, because I want to get a frame of reference where they're at. And it really helps me have a better conversation with them. Absolutely. And so what many people find was like, well, I'm so stressed out and I smoke pot before I go to sleep because it calms me down. And it relaxes me and helps me sleep, and I'm not abusing it. And, blah, blah, blah. So here are the things that I talk about when I've got someone who is smoking pot, and it's a point of concern, which it may or may not be in every visit, but I'm just saying. So number one, I tell them, look, and I'm in Texas where it is not legal. I say, if you didn't grow it, you don't know what's in it. And what do I mean by that? I'm not encouraging that they go out and get a greenhouse. What I'm saying is pot is sold by weight. And so, for example, illegal drug dealers add things to it to make it heavier. So they will add like crushed glass or sand. And you're inhaling this into your lungs. I mean, we know that that's bad. So that's one. Unfortunately, they will also put things in there to have a reputation for selling really powerful pot. So they'll put things in that will add hallucinogenic effect, whether that is formaldehyde.
Yep, that's the infamous wet.
Or LSD. There aren't a lot of kids, high achieving kids, that go into college saying, hey, I really want to try acid. There's a fair amount that get it inadvertently. And how do we know that? Because they come in, if they've had a bad episode. Again, I'm self-selecting. Ones who've had a bad experience, but we do drug screen, they say, oh my, I swear I only smoked pot. I didn't even drink alcohol. I was only, smoking pot. Like, here's your urine drug screen. And so we talk about that. So that's number one. If you didn't grow it, you don't know what's in it. Number two, it's not your parents' pot. There's a lot of whitewashing of pot, saying it's just no big deal. My parents used to smoke it, or my uncle used to, or Tilda, whatever. It's just important that young adults know that pot today has a much, much higher concentration of THC, which is that component that makes you, gives the euphoria and the hallucinations and such. So it went from, 4% to now you can get it routinely 15%. You can get it cultivated up to 30%. So it's a much more powerful drug. The other thing is, and here's a story for you. So something that I think I saw the end of every semester while I was working on a college campus would be a student that would come in, and honestly in my private practice as well. But someone comes in and they're super upset. They're anxious and depressed because they have just lost an internship or perhaps a job or graduate school. And why is that? Because they failed a drug test. Why did they fail the drug test? Because either one, they couldn't stop. Pot's not addictive. Well, it depends who you ask, and 1 in 6 teens can get addicted. So 5 out of 6 don't. So if 5 people didn't, it's not addictive. It's no big deal. They can just have it on the weekends, and it's not an issue, but not for everybody. Those are born with addictive genetics, right? Anyway, so either they couldn't stop, or they stopped, and they stopped 3 weeks in advance, or they stopped 2 weeks in advance, and they thought they would use the diuretic substances that people use that are all advertised. Oh, it'll get it, give you
so you flush it out of your system.
Right. And then they didn't have a urine drug test. They had a hair test.
Ooh.
And then they flunked their test. And so this is, it's a real thing. Wow. The other thing that frustrates me about smoking, while we're on that, not just pot, but vaping and stuff, is that, these are the kids that grew up who literally would say to strangers, "Oh, that's gross," if they saw someone smoking, because especially as physicians, we're all like, smoking's bad, blah, blah, blah. Right. And, they're like, I would never smoke. Well, except that now we see that with vaping, the juuling, that a large percentage of those kids will go on to start smoking regular cigarettes. We're like, oh my God, I thought we were past that.
Oh, wow.
I thought we'd check that box off. But it really does lead to that. So anyway, those are a few things that I generally like to share about pot. And I find if you can have a rational discussion about it, it's far more effective. Also, I will say, if you are in a state where it's legal, I am much less concerned about there being additives in there. And I think that so again, a lot of the texts and messages and phone calls that I get, people are like, oh, my kid's in, I'm going to pick on Colorado because that's a common one. And it was legal there earlier. And they're like, they're getting it from a dispensary. Is this dramatically worse than drinking? And like, we all have different risk tolerance. So we have to kind of talk through that. And I do think it is lower risk for many things if it is through dispensary. Now, that being said, again, we see pot. I mean, every psychiatrist that works on a college campus that I know hates pot. Why? Because it actually does not help with anxiety and depression. It can make it a whole lot worse, and it can, add in paranoia on top of that. So small issues with schizophrenia being more common in people who smoke pot younger, but that's a separate issue. But anyway, just want to throw
I see some of these patients in the emergency room. Unfortunately, the ones with the additives to this marijuana, the formaldehyde, they're paranoid. They're, it's
wild.
Yes, it's extreme. I've even prior to even going to medical school in New Jersey, at one of the toll booths, there was a young man. I think this is when I was volunteering in the hospital at this time. It was a young man that was found there. He was an international student, found just standing by the toll booth, barely with any clothes on, and just really paranoid, and found out marijuana with the formaldehyde, the wet there. And can you imagine being in a foreign country and and this and then you're away from home. You're already it's already college. You're already away from home. I mean, you're in a foreign country, and then boom, paranoia, and just I'm not even sure if that person was even able to get back to their quote unquote normal senses, because sometimes when some of these additives, that's it.
Right. No, I know in the past year of a young man who tried LSD, actually knowingly tried LSD, because his girlfriend thought that it was a good idea, that it was better than him taking ADD meds, because she was a psych major and she was learning about the uses of LSD with things, and he tried it, and it precipitated a manic episode that and would that have happened anyway with something else? It could have. We don't know, but we do know isolated cases where it does precipitate something, and you don't get a do-over for that.
Absolutely. Wow. This is so much. And I love the fact that you have a lot of this powerful information out there. It's there for the moms, the aunts. My kid's going off to college. What is a way for me to grip them with information that they can really go and look? It's there in the handbook, and it's not just Dr. Google, right? It's there from
to the best of my ability. It's all evidence-based.
All evidence-based, and it's there to help and to dispel some of the myths too. And I
Yep.
love the statistics that's out there to really pour into these students, because finding out that 1/3 of these students are not doing anything might be powerful for a student who thinks that maybe everybody's doing it. So it's
Actually,
good to know.
yeah, no, colleges have done studies about that, and
Mhm.
the discrepancy is huge. They will ask, what percentage of your peers do you think are drinking? And it's usually 85% that
Mhm.
people say that, and then they go back and look at the information from that same polling group and like, no, actually you're off by like you've doubled the number. And
Wow.
so,
Yeah.
you know, so I do think that it's important to have those stats out there. The other thing that is interesting to me is when we're talking about things that are really, really high, especially in our high achieving kids, is test anxiety.
Yes.
1 in 5, 20%
Mhm.
of college students have significant test anxiety.
Oh, yes.
Can we talk about that for a minute?
Absolutely, because it's something that will follow. And even for those who are even still high achievers, it still follows you on. For those who want to go into medicine, let's talk about continuous testing, like
Yeah.
all the time. Yes. So go ahead. It's a very important topic.
Okay. So I'll do my little spiel on test anxiety here. So the
Mhm.
first thing, especially if I'm talking to freshmen or freshman parents, either one,
Mhm.
is that you have to distinguish, do you have test anxiety, which is everything, you're really well prepared, and you sit down and you get to question 3 and you freeze, and
Mhm.
your brain goes blank, and you're shaking and heart racing and basically having the symptoms of a panic attack, and
Mhm.
that is crippling test anxiety.
Absolutely.
Or are you having, I sailed through high school, or I worked my butt off through high school, but with outstanding grades, and now my peers are up 10 levels from where my high school was, and
Mhm.
I'm not really actually prepared. And
Mhm.
it's really, really hard for super smart kids and super smart parents of super smart kids to kind of process some of that, but
Mhm.
understanding that. So the first thing I talk about is like, if that's the case, then we got to change the study stuff and
Mhm.
understanding almost every school now has a student success center. They call it, or academic success, they call it different things, but and there's still that, I don't need that. I'm a good
I
student.
know that I'm good. No, 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 no. Hey.
So one of the things
Mhm.
I'm actually working with a national college group of college professionals that work with this is to say, you have to show, don't tell. So ask them, do you know what a brain dump is? Do you know what a brain dump is? A
Mhm.
brain dump is, and maybe everybody knows this now in our group, but it was news to me a few years ago. But a brain dump is where right when you sit down for a test, whether it's dates or maybe a name or more commonly formulas for
Mhm.
et cetera, you sit down, they say go, you brain dump, you write down the 6 formulas that you had to memorize for this test, and then they're there. And then
Yeah.
your brain lets go of that, and you're not constantly having that repeating in the back of your brain, and you keep going. So
Mhm.
teaching them a brain dump, that's one thing. Second thing is teaching them effective study habits. And I have so many friends who are professors, and so I like to ask them, what's your biggest study tip? And actually, they say 2 things. One thing is, do not wait until you're in trouble to go talk to your professor. Go meet
Absolutely.
professors. In our family, again, my dad was a professor, so but our rule was first semester. I mean, the first 2 weeks of every semester, you got 2 weeks to go to office hours to meet your professors. Walk
Mhm.
in, say hello, introduce yourself, look at their bookshelf, ask them something, use your social cues, oh, you like to ski. Oh, or know something about their research, but go visit them because as a professor just literally told me yesterday, she said, I know it's not right, but I'm sure that I give those students a little bit more attention because I know them and they've shown an
Yeah.
interest. And
It's
she's
probably part of the human nature to when you've connected, right? It's part of connectivity and social.
right. So
Yeah.
one, go in and meet your professor. But the other thing they say is when you're studying, get a study partner or 2
Mhm.
or 3. But what you do is you pull up the PowerPoint and each slide you take turns and one person says, okay, what would Dr. Rushing ask from this slide right here? I think you ask blah, blah, blah. You ask, the other person answers. Go on the next slide, the next person does that. And when you do that, you're using so many more senses, and you're learning and you're understanding more than memorizing, and it's going to stick with you. So anyway, showing that student success centers can teach skills like that is a much bigger drive than saying, hey, everybody uses tutoring. You're going to be behind if you don't. You should go. It's like, no, let's give them concrete examples. So that's one. But back to test anxiety, which is not that. So for test anxiety, there are lots of things that we can do. Obviously, cognitive behavioral therapy is number 1 through 10 of what is super effective. And part of what that does is it stops from catastrophizing. So that's a word I always teach parents. I literally make groups chant with me, like, catastrophizing. We're not going to catastrophize, which is, oh my gosh, I'm going to fail this quiz. Then I'm going to flunk this class. I'm going to lose my scholarship. I'm going to flunk out of school. I will never be a doctor.
Yep.
It's that spiral, or the parents. And we are calm and we talk to them, and then we hang up, and then we go, oh my God, they flunked that, they're going to lose their scholarship.
They're catastrophizing. No, we just talked about this.
So we got to stop catastrophizing. So that's
absolutely
a big part of cognitive behavioral therapy, which can be just 2 sessions. I tell that's the thing. Like, people hear therapy and they're like, lie on a couch, talk about your mother. This is goal-directed, very short-term thing. And it helps them recognize that, you've been successful before. What happened before when you made a B? Like
the world did not end. That's important for you to recognize. Yeah.
And then obviously there's a lot of, behavioral techniques. People always roll their eyes when I talk about breathing. But when I say literally,
oh no, we're a fan of breathing in this show.
Breathing is good.
Yes.
Sitting down, and I say it's the 4-10 method. So you breathe in for 4, out for 10. 4 repetitions of the 4-10. Right when you sit down at the test, take a deep breath, do your 4 cycles before you even start reading. And it really does slow your heart rate down and calm you down. And then, honestly, God bless beta blockers, I prescribe a lot. And I think almost every physician I know that works on a college campus, and they very frequently are used 2 or 3 times. It's like the Xanax bottle that travels with people for fear of flying, They know it's in their backpack, they're okay. And the same thing happens with much less addictive or not addictive at all beta blockers. And so very, very low dose, and it slows their heart rate down. And I explain that, our brains listen and talk to our body. And if we're having physical symptoms of panic because our heart's racing and we're shaking and everything, our brain is going to say we're panicking. But by the same token, if your heart's not racing, you're like, oh, well,
maybe everything's okay. Absolutely.
And then you can be really calm. And I'm telling you, for Gen Chem is the number 1 class that sends
a lot of students. What about organic chemistry?
Right. But it's just that's these big weed out classes, or or physics, or P-Chem for engineering majors, or so pre-accounting people. They were fine freshman, sophomore year. The accountants come in, and the architects come in junior year. It's like you can sort of see when the different people come in. But there's really things that we can do to help with that. And so I want to reassure the parents and remind you that they can talk to, and whether it's a campus doctor, whether it's their primary care physician that is off campus. Some campuses have tiny little centers, other ones have huge. And I just, I'm here to dispel the quack shack myth. I went to Texas A&M, and we called the health center there what used to be called the quack shack. And there are many parents who refer to it as that way.
No. There are
really good physicians in university health that went there because they love young people, or they enjoy the college atmosphere. There's lots of reasons. And I was so impressed the first time that I went into the University of Texas. I've been in Austin for my practicing time, and I used to volunteer there. Sometimes it was 1 day a semester, and then and eventually I worked there part-time for a while, and it just like, oh my God, the quality is excellent. Excellent.
Absolutely. I think my brother went to UT. So yeah. So
He's a Longhorn.
yes, he's a Longhorn.
Love to do
So
with
yeah.
that.
So I do remember him, when we did the tour of the school as freshmen and seeing this wonderful center, so
It's great.
absolutely, absolutely. So, you are doing so much for all of these students. You're really out there. You've written a handbook for them. Some people, if they're blessed, they get that first aid kit. Well, the first aid kit is now in this beautiful book that is there to help, to provide great info, to dispel myths, for both, even though it's a college handbook for the students, also wonderful for parents to have an idea of what's going on. So what is Dr. Grimes doing for Dr. Grimes? How do you participate in self-care? Come on, we want to know. Let me know.
One, I married up. I married the best man on the planet. So sorry, ladies, he's taken. But
I love it.
No, but seriously, I have a super supportive spouse, and I have worked part-time for a long time. My parents, unfortunately, my mom got early Alzheimer's, and my father subsequently developed Parkinson's and Parkinson's dementia. And so, I obviously wanted to be able to care for them as well. And so having a supportive partner who allows me to pursue my passions is huge. And I do a lot of self-care, though. I mean, I'm definitely, I practice what I preach. So I exercise every day. I always have. Sometimes it's only walking the dogs. I'm Peloton, so I'm a Peloton girl now. So I always exercise. I really genuinely try and eat healthy. I love to bake. Baking is my love language. So I'm gluten-free. So I had to for a decade now. So, but I had to revamp that. But so I do that, and I the creative stuff is self-care, which clearly you get. And you're pursuing other things. So that is self-care for me, and I
love it. You're my second baker. It's the self-care. Dr. Megan Mello. She loves to bake too. So she's in self-care. So I love it, love it, love it. So now, we have the fun question of the day. If you weren't a doctor, Dr. Grimes, what would you be?
It's really hard for me to answer that question. You asked me that before we started the show. It's been in my brain. It's I mean, like, I'd love to be a rock star.
There we go. Yes, because we've had some backup dancers for we've had some dancers, we've had travel photographers, we've had travel journalists, we have gardeners, florists. Love it. My last one is an urban planner. So, isn't that cool? Yes. So I love it. So a rock star.
I would love to be out there singing in a band. It'd be super fun.
There we go. So let me know when you are ready. I will be there cheering on, because I cannot sing. I can dance okay, but then these newer kids, their new dances, I cannot do it. So I will be there cheering you on in the front row and doing my old school version of all this lovely dances. I love it. I love it, love it, love it. So now we have people are there to listen to this wonderful episode, and they're like, you know what? I love that doc. Where can I find her? Where can I find this book of hers? Because my kid's going off to college next year, and I've always wanted to know what I can get for them, or my cousin or my neighbor's son or daughter. So I'd love to get them this wonderful book. Let them know where they can find it.
All right. So you can, of course, I always try local bookstores first. We got to support our local bookstores. And who doesn't love the smell of books when you walk into a local bookstore, right?
Love it.
But Amazon frequently has the best price. So it is on Amazon. Make sure you click on the new version, which is coming out next week and on March 1st. You can pre-order it now, but it'll be delivered next week.
Oh,
And
nice.
you can also, Barnes and Nobles, and actually it's been at Target and Walmart too online. I'm not sure if they're going to do that with the new edition or not. But
oh, wonderful, wonderful. So there we go. Lovely. You can find this wonderful book at your local bookstore where you can sit, sip a little tea, and luxuriate in this book. Or you can go online on Amazon or Target, Barnes and Nobles, and see. And like you said, the newest edition is coming out next week. So pre-order. Let's see it again. For those of our Aggie people, she has, yes, there you go. The maroon color is for those Aggie people out there. Yes. Go ahead, show them the ring again.
And Crimson Tide and Stanford, you can all claim this.
Yes,
all right?
you can all, yes, the red is the red. It's different shades. You can all claim it. Wonderful, wonderful, wonderful. All righty, Dr. Grams, thank you so much for stopping by and providing this great info. I think that we've covered so much in this episode. This is one of those episodes that if you're listening, you might want to listen to it again and again and send it off to your friend. Send it off to 5 friends or to those college students that they're freaking out, thinking that the world is ending because, oh my gosh, I have this upcoming exam and I've been freaking out. I was such a great student in undergrad or in high school, and then now things are changing. Or even if for those who are going off, we said for college, but testing anxiety goes on even when you go on to professional schools, right? You're now in grad school and medical school, dental school, law school, and things are changing.
High school. It goes on in high school.
Yes, it also starts in high school. So all this wonderful information, it's there in that book. So just go ahead and get it. Now, for those of you guys who are listening, I know you're like, ooh, this is a 5-star episode. Yes, it is. Go ahead and leave Dr. Grimes a 5-star review. Let her know how much you enjoyed her episode here on the Docs Who Care show. And you'll be able to find all this wonderful things on our Docs Who Care website. Just go to yourcaringdocs.com. That's URCARINGDOCS.com. Click on the podcast tab and boom, you'll see Dr. Graham's beautiful face. You can click to listen to this wonderful episode. Alrighty, thank you all for stopping by, for watching, and for listening. We will see you guys next time. Bye-bye.
Bye.